Good day, my dear undergraduate and emerging postgraduate students. The clinical history for today's class is an 18-year-old Swedish boy from Europe was brought to the general hospital with trembling hands and a pill rolling movement. On examination, he was found to have a massive splenomegaly and a moderate hepatomegaly. He was also having a moderate anemia. The bone marrow revealed, and your diagnosis is I hope you people are able to appreciate what is seen on the screen. This appearance I shall recall later. Welcome to What Next? The diagnosis is Gaucher's disease. The subjects involved are medicine, pathology, pediatrics, and to some extent biochemistry. And this is for all MBBS students. Gaucher's disease. It occurs due to mutation in the gene that codes for glucose cerebrosidase. Always, when there is going to be a deficiency of an enzyme, the substance before it will start accumulating. So, glucose cerebroside is being acted upon by glucose cerebrosidase. Therefore, when there is going to be a defect in this enzyme, there will be an accumulation of glucose cerebroside. This deficiency leads to accumulation of this in the mononuclear phagocytic system cells, MPS. It can be the macrophages, it can be the monocytes, sometimes bone marrow cells, histiocytes, etc. Glucose cerebroside is a phospholipid that is released from the damaged cell membranes, especially the senescent RBCs. Senescent means old, more than 100, 120 days. And Philip Gaucher was a person who identified this disease. Some say he is a neurologist, some say he is a psychiatrist, but those days people used to cut across disciplines. Courtesy Wikipedia. Degradation stops at the level of the glucose cerebroside. And you find that this substance gets accumulated in the macrophages. The Gaucher cells, as in the original picture, are large. They are having an eccentric nucleus, slightly eccentric. In an adipocyte, it will be totally. And the cytoplasm will be having a crumpled tissue paper appearance because it is all linear appearance of lysosomes. That is why you have got a crumpled tissue paper appearance. And this is a Radiopedia CT scan, courtesy again to them, showing a splenic Gaucheroma. So look at this one. There is a case of a splenomegaly and it is showing some darker areas. Probably these are some areas of accumulation or whatsoever. And there is also a hepatomegaly that is to be seen. What are the types of this Gaucher's disease? Mainly, we should remember that there are three types: type 1, type 2, and type 3. And type 1 is 99% of the cases. It is found in people called the Ashkenazi Jews. It can occur in the adults, young adults, or the middle-aged persons. CNS is not affected. Please note it down. CNS is not affected. It is chronic, non-neurogenic. There can be a splenomegaly, hepatomegaly. Osteopenia will be there. So this is type 1, which is most common, 99%. The remaining 1% is shared by type 2 and type 3. In type 2, you find that it is acute infantile. Hardly the child will live beyond 2 years of age. It is neuropathic. Patient will be having hepatosplenomegaly, seizures, neurogenic, loss of vision, neurogenic. And the third type will be chronic neuropathic, type 3. Both of these have 1 in 1 lakh live births. This is from the region of Norbertum, where it is, we shall be seeing. Late teens to early adulthood patients are involved. It is a slowly progressive disease. There can be hepatosplenomegaly, common to all, seizures, lack of coordination, poor vision. I hope you people can superimpose this particular table to the clinical history that has been given, and you can come to a diagnosis. Further to all of this, the patient can be having dental malformation, infections, because the bone marrow is going to be flooded with other cells, and the bone marrow elements are reduced. So this is the one, an important table that you people should remember. As I told you, you must frame your own MCQs. What is more interesting is the patient with Gaucher's is 20 times more risk prone for Parkinson's disease because of alpha-synuclein. So there is a coordination between the Gaucher's, Lewy bodies, Parkinson's by means of this synuclein. 10 to 20% of the Parkinson code have got mutations for the glucocerebrosidase gene. That is why these people can have it or vice versa. Alpha-synuclein level is involved in the pathogenesis of Parkinson's also. Please remember, this is a wonderful table or a diagram for us. The therapy will be, whenever there is going to be an enzyme deficiency, you will have to replace it lifelong by infusion, recombinant glucocerebrosidase. Or you'll have to give a substrate reduction therapy. That is what is there, via oral inhibitors. You stop the product that needs the enzyme. Recombinant glucocerebrosidase and drugs. I would like you people to refer to the other texts. But please do remember these two things, ERT, SRT. ERT is enzyme replacement therapy. SRT is substrate reduction therapy. See you again. This is supposed to be a beautiful movie of it where I think they are getting parted. And this, I told you people, is Norrbotten, Sweden. So this is Sweden and this is the particular place of Norrbotten from where the patient is presumed and assumed to have come. And this area is prone for this Gaucher's type 3. See you in what next?